Hey everyone, I'm going to briefly go over chapter 5, which is concerning death. Death as a process, not necessarily an event that occurs. So today we're going to talk about the antemortem period, which is before death, the dying process, and postmortem, physical and chemical changes. So I'm going to share my screen. All right. Chapter 5, an embalming, death, agonal, and postmortem changes. Death is a process and not a moment in time. And during this process, there's a series of physical and chemical changes that occur that start before the medico-legal time of death and continuing after. In the sequence of death, there's a point of irreversibility that can generally be diagnosed by physicians. And once this point is reached, nothing more can be done to restore intelligent life. The average person identifies death as when someone draws their last breath, right? But there's a sequence of steps leading up to that point, and this is known as the agonal period. It can be short, like in a car accident, or it can be long, like in a terminal illness. Agonal refers to death or dying. During the agonal period, the body is moribund or dying. The physical observations that can be made during the dying process include the death rattle, the respiratory gurgling or rattling in the throat of a dying person. That's caused by the loss of the cough reflex and the accumulation of mucus. And there's also the death struggle, which are twitches that often occur before death. Once the body loses its ability to sustain physiologic and metabolic activity, somatic death occurs, which is death of the body. Death proceeds in an orderly progression from clinical death, which is reversible, to brain death, also reversible, then to biological death, which is irreversible, and clinical, biological death, and then postmortem cellular death. Clinical death occurs when spontaneous respiration and heartbeat ceases. At this time, that person can be resuscitated. So clinical death is reversible. If the person can't be resuscitated, if it's not reestablished, then brain death can result. Biological death refers to the period in the process where simple life processes of the various organs and tissues of the body begin to cease. When biological death occurs, respiration and circulation cannot be restored. At some point, individual cells will use up all those stored elements or will be overcome by autolytic processes and die. This is postmortem cellular death. The progression of cellular death can continue for a number of hours after somatic death, so there can be a delay in the breakdown of these cells depending on the stores of energy in that body. There's factors that influence the onset of postmortem cellular death. This could be the cause of death or the manner of death. The cause of death, sorry, I'm about to sneeze. The cause of death or manner of death, depending on how sudden or drawn out it is, can really influence this, the kind of medications that person was on, environmental conditions. Hot and moist are always the worst conditions. Heat always accelerates chemical changes. Condition of the body, the amount of body fat, you'll see that in larger bodies, there's a lot more insulation, there's a lot more energy stores. That body could break down a lot slower. A corpulent or obese body will break down a lot faster. I apologize, because of all that body heat and maintaining that body temperature, right? Smaller bodies are going to break down slower. Larger bodies will break down faster. Also, the amount of clothing on the body, if they're bundled up, that could influence body temperature and the cooling of the body after death. And any kind of medications people were on. We see a lot of drawn out deaths now, terminally ill, chronic health conditions. Those could also delay the onset of decomposition, different influences from certain medications. The antemortem period is the period before death. So ante meaning prior to, mortem meaning death. These are changes that take place before death. So 2 terms you need to know: necrobiosis, which is the natural death of cells as they complete their life cycles and are replaced. So death and life, necrobiosis. Necrosis is different because it's the pathologic death of cells because of disease. And pathological death of a tissue can occur while still part of a living organism due to the lack of oxygen to the cells. So think gangrene. Decubitus ulcers or bed sores, also known as pressure sores from people who are bedridden. These are caused by staying in the bed, which is a hard surface. So where the dependent parts make contact with that hard surface, it cuts off blood flow to outer cells of the body. That's why it's important to make sure that the patient is turned periodically, or they can develop bed sores. So as the process of death progresses, there's changes that take place in the body, which is known as the agonal period. The agonal period changes are categorized according to their effect on the temperature of the body, the ability to circulate blood, and the moisture content of the tissues, and also the translocation of microorganisms within the body, that after death, there's no longer a barrier, so they're able to spread. Let me touch back on here real quick. These are also antemortem things that can occur. There can be a buildup of gases in the body, like air edema, which is nosocomial, hospital-induced edema caused by the respirator pumping air into the body. Gangrene is necrosis of tissue of a part of the body due to absent blood supply. You'll see this in diabetes patients because the feet, the distal areas of the body, can't get sufficient blood flow, sufficient oxygen, right? There's 3 different types of gangrene. There's dry or ischemic gangrene, which is due to lack of blood flow. Wet gangrene is when bacteria invades and multiplies in that gangrene. It's an infection. And then there's gas gangrene, which is caused by Clostridium perfringens, which is a pathogen we talk about in micro. It's the same pathogen that causes tissue gas. All right, so changes that occur during the agonal period. So we just talked about things that happen ante-mortem. These are changes that occur while the person is dying in the agonal period, still before death, but dying. So there's going to be different changes, temperature changes, circulatory changes, moisture changes, and of course, the translocation of microorganisms. So for temperature changes, there's two thermal changes that can occur during the agonal period. Agonal algar, which is the cooling or decrease of the body temperature prior to death. This is seen in elderly patients when death is occurring slowly, their body temperature starts to drop. An agonal fever would be an increase in the body temperature before death. This is seen in people that have infections, toxemia, blood poisoning, and if that person is dying from ingestion of a poison. So elevated temperature with agonal fever also stimulates microbial growth. There are circulatory changes. There's 3 circulatory changes that are possible in the agonal period. Agonal hypostasis, which is the settling of blood and the dependent tissues of the body. It occurs because of the slowing of circulation just before death, which allows the force of gravity to overcome the force of circulation. So it's kind of like a stasis. The blood will settle into the dependent tissues where if you were to move or roll over that body, you could see a discoloration beginning to form. Hypostasis is the actual process that causes that. And when we talk about postmortem changes, there's a discoloration known as livor mortis, which is caused by hypostasis after death. So this is still agonal. Agonal coagulation occurs because the blood circulation has slowed. The blood begins to clot and congeal. Agonal capillary expansion is the opening of pores in the walls of capillaries. This is the body's attempt to get more oxygen to the tissues and cells. So if you've ever seen an autopsy or things like, or well, I hope it would not be outside of that. If you've ever seen an autopsy, sometimes the pathologist can have like a specimen from the lungs, and you can actually see kind of like the pores opening where that body was trying to get more oxygen before death. There's moisture changes, which are shifts in the balance and location of body moisture. Agonal edema is an increase in fluids to tissues of the body. This can result from disease or from capillary expansion. These changes can influence each other. There's agonal dehydration, which is a decrease in fluids in the tissues. This could result from disease processes or from agonal capillary expansion. Then we have translocation of microorganisms, which is the movement of microorganisms from one area of the body to another. And this occurs because there's no more natural defenses in the body. So the body can't keep it in check. The movement could be a result of the microorganism's natural motility, the ability to enter the bloodstream, or the movement due to hypostasis or the shift in body temperature. The relationship between agonal edema and agonal dehydration is also shifts in balance and the location of moisture. So the surface loses it, it goes to the dependent tissues. All right, microorganisms can use that to their advantage. There are microorganisms indigenous to intestinal areas, and they can access or gain access to the blood vascular system because of capillary permeability changes. All right, then we have the signs of death. I don't know if that page number is correct, if that's the 5th edition or the 6th. But The signs of death are cessation of respiration, cessation of circulation, muscular flaccidity, which is complete muscle relaxation. Um, we'll talk about rigor mortis and the different stages of that. Primary flaccidity is where the body first loses that uh, it's complete muscle relaxation. Changes in the eye, you'll want to know the changes in the eye are a sign of death. There's going to be a clouding of the cornea, a loss of luster of the conjunctiva, flattening of the eyeball. This can occur to 4 hours after death, whereas immediately after death, there's those dilated, unresponsive pupils. This is why we use eye caps when we're in the prep room, when we're setting features to give that natural contour of the eye, because death you'll see flattening of the eyeball. So you want to make sure that it has that natural curvature. Postmortem lividity, also known as liver mortis, also known as cadaveric lividity, sign of death, that discoloration in the dependent tissues, regardless of what position the body is in, supine in the hospital bed where they're face up, right? It could be in the back, wouldn't have any issues there for viewing purposes. But if a person dies in the prone position, face down, that lividity, that liver mortis, can pose an issue if time passes enough for it to turn into postmortem stain, which is extravascular, whereas liver mortis is actually inside of the blood system, so we can remove it through the injection of chemicals. Other signs of death, rigor mortis, the stiffening of muscles. So the body will go primary flaccidity, relaxation, within so many hours, dependent on intrinsic and extrinsic factors, stiffening or the um, action of all the muscles in the body, drawing. It's the muscles, but it acts on our bones, our skeletal bones, right? But it's actually every muscle in the body that's affected. Algor mortis, the cooling of the body. And then, of course, the most obvious sign of death is decomposition. Can't deny that. And we have post-mortem physical changes. So remember, sometimes we call autopsy cases post cases. Post-mortem changes, there are physical changes which are brought on by gravity, surface evaporations, and the stopping of blood circulation. And then there's chemical changes that occur within the body. So physical changes include algor mortis, which is the postmortem cooling of the body. Over time, the temperature of the body will cool to the temperature of the surrounding environment. If the surrounding environment is 70 degrees, the body will cool to 70 degrees. So over time, this occurs, and the rate at which the body cools depends on many variables and factors within the body, intrinsic factors, and outside of the body, extrinsic factors. So it's important to understand the difference between intrinsic and extrinsic. Intrinsic factors include the ratio of surface area to the body, of the body to the body mass. So how big the body is. Um, the body temperature at the time of death. Was there agonal algor? Was there cooling before death? Was there agonal fever before death? Or it could be a combination of any of those. Extrinsic factors that affect postmortem cooling of the body would be body coverings. Are they dressed? Are they covered with a blanket? Also the surrounding environment, for example, rapid cooling of the body, occurs through refrigeration or cold weather. Um, Water, was it in water, warm water, cold water? Um, this can be beneficial to the embalmer if there is algor mortis because it slows the onset of rigor mortis and it keeps the blood in a liquid state. But a body that's rapidly cooled will have more intense discolorations from liver mortis and also postmortem staining. And if body tissues were to be frozen, there could be capillary damage. Only other side, affecting algor mortis, body coverings are an extrinsic factor. This is clothing or other coverings that protect the skin from exposure to the environment. This adds insulation to the this adds insulation of the body and slows the process of heat loss. All right, another postmortem change is hypostasis. This is the process, not the discoloration. Hypostasis is the process through which blood settles as a result of gravitational movement in the vessels to the dependent or lower parts of the body, which are the parts of the body closest to the ground. It's important to note that the movement of blood can be affected by constrictions, ligatures, or other factors that impede free movement of the blood within the vessels. Contact pallor is a term you want to know. It refers to areas where blood movement is inhibited. So, where the body has been in contact with the surface. So, let's say that body is in supine position when that person died, where the tissues of the body actually touched the ground, the bed, that's actually going to be white, a loss of color. Oh, well, not white, obviously, like Caucasian. I didn't mean that. Um, they're going to be lack of color there. And then parts of the body that weren't touching the table, there's going to be that blood discoloration because it's settling. So contact pallor. This could be the weight of the body pressing against a hard surface. So the surrounding area may be discolored, but any contact will stay pale. Livor mortis is the settling of blood. Well, from hypostasis. Livor mortis is the discoloration. This can appear within a half hour to 2 hours after death if it didn't occur in the agonal period. Livor mortis is a post-mortem intravascular blood discoloration that's a result of hypostasis. It's also known as post-mortem lividity or cadaveric lividity. It's first noticed in dull red patches, but as it becomes more established, it can take on a reddish blue appearance. Livor mortis is intravascular, meaning we can remove it through embalming. And the best way to tell the difference between livor mortis and post-mortem stain is to press on the skin, and if it clears, it's livor mortis. It's still intravascular. Dehydration is another physical change that occurs. It's the loss of water from body tissues through surface evaporation. There's two basic factors, surface evaporation and hypostasis of blood and body fluids. As dehydration occurs, blood becomes more viscous, and eventually the blood will clump together, forming a sludge. So dehydration brings about surface discolorations, ranging from yellow into browns and finally black. An increased viscosity of blood would be a physical change brought on by dehydration. After death, the blood thickens. And then endogenous invasion of microorganisms. So physical change, not a chemical change. The colon is a primary source for many of those microbial agents. That's why we cavity embalm. For the embalmer, the most troublesome organism that could translocate and cause definite postmortem changes is Clostridium perfringens, which can cause tissue gas. It's a gas-producing anaerobic bacillus, rod-shaped, going back to micro, responsible for tissue gas. It can be its presence through the body after death can bring about immediate problems within just 1 to 2 hours. If the organism is present in the tissues, it produces gases that distend to the point where the body could be unviewable. Right. These are embalming significances of each of those physical changes. So, algor mortis, not necessarily a bad thing. Slows rigor, slows decomp, keeps the blood in a liquid state. But if it happens too rapidly, it increases the degree of those discolorations, livor mortis, and postmortem stain. Hypostasis, the significance to us is that hemolysis can occur and cause postmortem stain, depending on the span of time. It increases tissue moisture in the dependent tissues, um, causes surface dehydration. Livor mortis, significance, the discoloration is slightly red to reddish blue, depending on blood volume and viscosity. It's intravascular, so we can clear it. It's not a major concern. In fact, as it clears through arterial injection, it's a good sign that you're having good fluid distribution. Dehydration can actually be massaged from an area. Remember, massaging can help not only your chemicals reach the distal tissues, but you can manipulate body moisture. Dehydration darkens the skin. It can't be bleached. It can cause wrinkling and shriveling of features. And if extreme enough, it actually does preserve the body, but not in a way that we would want. An increase in blood viscosity, you get an increase resistance for arterial injection. It's also going to hamper your drainage. And of course, endogenous invasion of microorganisms, bloodborne pathogens, dangerous to us, promotes decomposition. These are chemical changes. Postmortem chemical changes include postmortem caloricity, postmortem stain, shifts in pH, rigor mortis, and decomposition. Postmortem caloricity is the continuation of metabolism after death. And it continues as those body processes continue, it creates heat. So this can be responsible for an elevated postmortem temperature. Postmortem stain is an extravascular blood discoloration brought about by hemolysis of the blood, the breakdown of blood cells. After death, the blood gravitates to the dependent areas through hypostasis. It forms livor mortis. Over time, the red blood cells begin to break down, causing stain. This can occur 6 to 10 hours after death. Of course, this varies with intrinsic and extrinsic factors. If postmortem stain results, it's permanently fixed because it's extravascular. So we can bleach it, but we cannot remove it. Shifts in body pH are a chemical change. So remember the pH scale. 0 to 6.9 is acidic. 7 is neutral. 7.1 to 14 is basic or alkaline. So the normal pH of the living body is about 7.4. We operate slightly basic. And that's actually the pH that embalming chemicals work best at. Or formaldehyde, the traditional. After death, there's a drop in pH of the blood and tissue fluid. It goes into the acidic range, about 6. and the body remains acidic during rigor mortis, and gradually, through decomposition processes, the body becomes increasingly alkaline. So this is why we use buffers in our fluids to kind of buffer it to that ideal pH range for our chemicals. Rigor mortis is the postmortem stiffening of muscles. It's a natural process, but it is a chemical change. And once this condition passes, it does not reoccur. So if we get a body into our prep room that has rigor mortis, you just massage it. You can break rigor, uh, break it in the arms, because we want to make sure that's not going to impede our chemical distribution through the arterial system. It's not going to hamper drainage because that would be an external pressure. Once it's broken, it does not happen again. Usually the muscles are relaxed as death occurs, and this stage is known as primary flaccidity. Within 36 to 72 hours, rigor mortis passes naturally from the unembalmed body, and it's known as secondary flaccidity. So primary flaccidity, body goes slack, rigor, and then secondary flaccidity. It occurs in the average body about 2 to 4 hours after death. If embalming occurs while rigor is fully developed, that stiffness of the muscles actually impedes distribution because it's an external pressure. Rigor is first demonstrated in these small muscles like the jaw, gradually becomes evident in the larger muscle groups, and the directional occurrence for rigor is from face to the feet. It can be forcibly broken by bending, rotating, and massaging joints, which is where your skeletal bones meet, and massaging the muscles. And once broken, does not come back. Cadaveric spasm is the sudden involuntary movement or convulsion brought about by these involuntary muscle contractions and can be associated with rigor. Decomposition is a chemical change that occurs. It's the breakdown of compounds into simpler substances through bacterial or autolytic enzymes. It involves autolysis, the self-digestion of cells. Remember, lysis, the suffix means breakdown. So auto, self, digestion of cells. Hydrolysis is an important factor in the initiation of decomposition. Protein decomposition, putrefaction through anaerobic bacteria, and decay is through aerobic bacteria. Adipocere is a chemical change. It used to be called cemetery or grave wax, thought to be composed of fatty acids. It appears in bodies that have been dead for an extended period of time, and it has to do with pH changes as well. It's actually, it can keep the body in stasis. Right, the embalming significance of these are that for rigor, it makes positioning more difficult, especially if you get the frail elderly bodies that died kind of hunched over with the arms pulled in those hospital beds. It can be very difficult to position them from time to time. You also have to remember that with the elderly, the bones are more brittle, so you don't want to accidentally break a bone trying to break rigor. It also affects muscles of the jaw, so closing the mouth can be difficult. It reduces absorption of the preservative, and because of the pH changes during rigor, which are acidic, it can affect the chemical reaction of our embalming solution. Remember jaundice. Jaundice is a yellow discoloration, but in an acidic environment, in a highly acidic environment, it could convert to a green discoloration. So It also, on the other hand, rigor can create a false sign of preservation because the body feels firm, but it's actually due to rigor mortis and not the embalming chemicals. Postmortem stain, significant because it cannot be removed through injection, and it can result in a gray discoloration through the reaction of formaldehyde and hemoglobin. It causes embalmers gray. There's a sign of delay between death and embalming, or that is a sign of delay, and it indicates an increased preservative demand, meaning you want to use a stronger solution. Postmortem caloricity, increase in temperature after death, speeds up rigor, speeds up decomposition. Shifts in pH will interfere with our arterial solution reactions. And of course, decomposition processes that occur. Tissues could distend and swell during injection. You could have poor distribution. If the body is beginning to be in decomp, there's an increased preservative demand, discolorations, odors, skin slip, desquamation, gases in the cavities and tissues, which then create purge. Important to know all right, where I'm at. The order of decomposition of body compounds. So first the carbohydrates, then the soft proteins, followed by fats and hard proteins. The very last thing that would decompose in a body are bones, because they're inorganic, right? The vascular system is actually one of the last organ systems to decompose. These are just a few trivia right here. Decomposition is slowed uh, or completely stopped at temps below 32 degrees. Of course, you never want to freeze a body. You need to maintain, if you place a body in refrigeration, above freezing temperature. But also decomposition would be stopped at temperatures above 120 degrees. The optimum temperature for decomp is 98. It's also important, this is from your tag, not your book, the order of putrefaction of the viscera, understanding what's going to break down first. So decomposition of proteins by the action from anaerobic bacteria is putrefaction. The first is going to be the lining membrane of the trachea and the larynx, is moisture, higher moisture content right there. But in the infant, it would be the brain. So you would actually, when you're treating an infant, you need to treat the brain. And we actually talk about that in embalming too. Also, the first would be a pregnant uterus because of all that amniotic fluid, all that body moisture, it decomposes faster. The last thing to decompose are going to be the large blood vessels and the non-pregnant uterus. The 5 classic signs of decomposition are color changing. The first external color change that occurs in the unembalmed body is over the right lower quadrant of the abdomen. This is caused by a combination of hydrogen sulfide, which is a product of putrefaction, and hemoglobin from the blood. In many bodies, this discoloration follows the surface outline of the large intestine, which is right beneath the abdominal wall. Odor is another classic sign of decomposition. It occurs as proteins decompose, so they're putrefactive odors. These become more apparent, very obvious. This odor is caused by foul-smelling amines, mercaptans, and hydrogen sulfide. Desquamation, also known as skin slip, is the hydrolysis of collagen and elastin that causes the superficial skin to be pulled away easily from the deeper skin layers. As decomp progresses, The accumulation of gases and liquids separate the layers of the skin and it forms blisters. We have gases that will form in the viscera as decomposition progresses. This generally begins in the stomach and the intestines. The gases will cause the abdominal cavity to swell, and later gases will form in the tissues of the body. It causes tissues to swell. Gases can actually be moved by the application of pressure. This movement is called crepitation. It actually you can hear it in the tissues as you're manipulating them. It makes a crackling sound. The weakened areas like the eyelids, the scrotum, and the breasts easily distend with gases. In time, it affects the eyelids, the cheeks, and the lips to the point that the tongue will actually protrude. Gases manipulate and influence purge. Purge is the evacuation of gases, liquids, and semisolids from the natural body orifice. And decomposition purge is generally caused by the buildup of pressure from gas formed in the abdomen. Purge from the stomach is foul smelling. It resembles coffee grounds. Purge from the lungs is frothy and pinkish red. And stomach and lung purge usually exit from the mouth and nose. You could have purge of cerebrospinal fluid in trauma cases if there's been like a bone fracture and that fluid is able to come through. That could be like a creamy white, highly infectious material. So you want to be very careful coming into contact with that. For test of deaths, take that with a grain of salt. I don't know. I don't see the test every year, but I just like to say that. So students will be prepared. Knowing the difference between an expert test of death and inexpert test of death. Expert tests are performed by medical professionals. This includes stethoscope, ophthalmoscope, EEG, ECG, EKG, and an evoked response, meaning the body actually responds. Inexpert tests, which can be disproven or not reliable. The ligature test, which is, I'm sorry, I should have erased that. Ligature test, which is where you tie a string around the finger to see if color changes. Ammonia injection, which is something that can be done where you inject ammonia into the skin, see if there's a color change. Pulse is not reliable because it could be slowed to the point where it's not, you can't pick it up. You'd have to use a machine. And listening for respiration or heartbeat is not reliable. Tag definitions you want to know, I'll let you do that. It's always good to know your glossaries. All right. So let me know if you have any questions. I'll be doing embalming chemicals, chapter 6 next. Thanks for tuning in.